In 1932, in Tuskegee, Alabama, the U.S. Public Health Service recruited 600 black men, 399 with syphilis and 201 without. They were told they would receive treatment for bad blood. In truth, they were not treated. Instead, researchers planned to observe untreated syphilis as it ran its course, believing black bodies would react differently to disease. Clinicians told participants their results were confidential and encouraged them to keep coming to the local clinic. Researchers documented symptoms, prescribed cures that were only pretend, and recorded outcomes with the confidence of a long-term project, regardless of the men's growing pain. That was the price of the data. Over the years, the men were monitored, reassured, and offered placebos. When penicillin became the standard cure in 1947, the study did not stop. The men were not given the medicine that could have prevented suffering. That decision turned a medical question into prolonged harm. As time passed, illness deepened. Some developed severe complications, others died. Syphilis also moved beyond the men. Wives were infected, often unknowingly, and pregnancies produced children with congenital syphilis. The government continued to watch and record outcomes for roughly 40 years, collecting data while participants' health deteriorated. In 1972, a whistleblower, Peter Buxton, exposed the study. He had voiced concerns internally for years, but they were ignored. By the time the truth surfaced, 28 men had died directly from syphilis, and about 100 died from related complications. 40 wives were infected, and 19 children were born with the disease. President Bill Clinton issued a formal apology in 1997, 65 years after the study began. The last surviving participant died in 2004. So when Black Americans distrust the medical system, it is not irrational fear. It is documented history created deliberately and allowed to endure. Subscribe to Case Files TV, stories the system once forgotten.